Hello and good afternoon, everybody. Welcome to today's AI in Medicine lecture. I will be presenting to you about AI in healthcare logistics. So, firstly, to introduce myself, my name is Chun, and I have been the logistics officer on the AIMS exec team since its inception in 2019. I am a second-year biochem student at the U of A, and I have about 3 years of experience working in hospice and hospital settings. So my responsibilities included a lot of administrative work, housekeeping, transporting patients, and stocking supplies. You get the picture. It wasn't exactly glamorous work, but it certainly gave me a deep appreciation of what goes into running a healthcare center. So before we begin, I would like to give special thanks to Lori Harding, the site director of the Rocky View General Hospital. I was actually lucky enough to sit down with Lori for an interview in order to prepare for this presentation. And without her generously given expertise, this would not have been possible. The Rocky View General Hospital is a large hospital in Calgary with 650 beds, and Lori runs the building as site manager. So the goal of today's presentation is to introduce you to how healthcare logistics currently work so that you can get a good idea of how AI can come into play and improve delivery. I will aim to answer the 3 questions on the screen right now throughout this presentation, and I hope the audience will also keep them in mind as we go along. So, healthcare logistics covers many aspects, but today we will be splitting the presentation into the topics on the screen here. Financials, building management, patient management, and staff. Throughout this course, you will have learned many things about how medicine can benefit from AI. However, medicine is not all of healthcare. In order for treatments to be delivered effectively to patients, these parts of healthcare logistics are crucial to the system. So, our first topic will be finances and how AI can help manage the finances of a large healthcare institution, such as a hospital. This will include buying equipment, managing inventory, billing, auditing, and financial oversight. Okay, first of all, I will be talking about how finances are currently managed within the system right now. Firstly, I would like to define something that you might not be familiar with. So this is cost per case. It is defined as the cost to provide a care to a standard hospital patient, and it's used as a metric for many budgetary reasons within a hospital. And the cost per case equation is also written on the screen here. It is equal to the total patient expenditures of a hospital divided by the sum weight assigned to all cases. And the first example of when finances might come into play within the hospital is when you're buying equipment and furniture. So through talking to Lori, I was able to understand that there's actually surprisingly no funds set aside for specifically for medical equipment. This is, for example, large machines such as various scanners, specialized OR tables, etc. And she actually told me an interesting anecdote. Right now at Rocky View, they have a piece of surgical equipment that has been broken for 18 months, and they have tried to get funding to get it replaced for 18 months, and it still hasn't been replaced. So they're just sitting there with a broken piece of surgical equipment, and the money for that would come straight out of the emergency fund rather than a fund set aside specially for equipment. As for buying furniture, staff will physically walk around the hospital and take note of where furniture needs to be replaced. So there's no digital inventory of storing information about what furniture is currently there and how old it is and what condition it's in. So staff of each unit will see where they need to replace their furniture, and then they will probably report to Lori, the site director, if they want to have funding in order to buy new furniture. And another example of where finances might be important in a hospital is supply chain standardization. And what this means is basically there being rules about how many supplies that you can use for a certain case. For example, if you walk into an OR, there's a set number of a certain supply that is in the OR always, and this has to be replenished at a set schedule. And also at nursing stations, there's certain supplies that need to be there. And as well as in each hospital room, there's supplies and equipment that have to be there. Basically, there's a set number of these things that have to be present. And yes, there are very strict standards for this across the Alberta healthcare system, and not just within each hospital, but across the provincial healthcare system as well. And I asked Lori about how they deal with expired supplies and situations such as that. And she said that soon to be expired supplies, if staff see that it's like a week from expiring, it will probably be moved to a unit where they actually use the supply in great amounts. For example, there's many supplies that, for example, are mandatory to be kept in every unit, but some units don't use it as much as other units. So if there's some specific supply that's used a lot in one unit and not in another, they'll just move it to the unit where it's used a lot before it expires. And in that way, they sort of adapt to prevent as much waste as possible when they're buying supplies. Okay, and I will continue talking about how the finances are managed currently with regards to billing and medical codes. So if you don't know, medical codes are codes used to describe procedures, diagnoses, and treatments by medical staff, doctors, nurses, etc. Basically, if you have a broken arm or something, there is like a specific code for that in order to communicate it with like other medical staff so that they know like how much the treatment would cost for it and things like that. So this is actually kept in a giant book called affectionately referred to as the DAD. So it's like a gigantic dictionary with many medical codes in it, and each code has like a specific procedure or like a condition assigned to it, and this is what hospitals use to categorize things. And this code is manually entered into the computer system by hospital staff, and yeah, as you can imagine, it takes up a lot of time in order to look up these codes in this huge book and then enter them correctly into the system. Of course, it's very menial and tiring work as well. So another thing about billing, Canada has universal healthcare, as we all know. So provincial residents do not have to pay out of pocket. It's the taxpayers who pay for them by paying for the healthcare system. And out of province patients will have their expenses paid for by their province. So there's a sort of communication between the Alberta healthcare system and, say, for example, someone who came from Saskatchewan, the Saskatchewan provincial healthcare system will communicate with the Alberta healthcare system in order to pay for their care. And unfortunately, those who are not Canadian citizens are out of luck. They either have to like pay for things out of pocket by themselves or have insurance or something. And often cases, prices are much higher and like costs are much higher for treating like non-Canadian citizens. So with regards to financial oversight, the hospital is audited for incorrectly entered codes by the Alberta healthcare system, but the cost of auditing is frequently more expensive than the actual mistake. So oftentimes it wouldn't really make sense for the hospital to fix every single mistake and correct every single financial mishap that happens. Okay, so here now we've come to what AI can do to help improve the financial side of healthcare. First of all, an important thing to understand is that the healthcare budget is very much stretched to make things work as they currently are. Many healthcare workers don't actually get paid for overtime, and Lori told me during our interview that they currently have this broken surgical machine that's been waiting 18 months for a replacement, right? So many specialized medical machines are very expensive, with costs ranging in the hundreds of thousands of dollars. Also, since these machines are typically used for a very long time, it's understandably difficult for a human administrator to keep track of how much these medical equipment should cost on a periodic basis. However, when such a machine breaks down, and it's critical to replace like as soon as possible, we wouldn't want a lapse in patient care because there's not enough money to replace it. This is where an AI could be helpful because an AI could predict when a machine is likely to break down based on, like, for example, usage, age, or maintenance. thus helping us budget for repairs and replacements. It will prevent such large unexpected expenses from throwing off our budget and forcing us to take money out from an emergency fund, for example. Now, an AI can also be used to perform a cost per case analysis, which I defined beforehand, in a much more detailed and accurate manner than it is currently done. This is because AI can catch discrepancies between expected costs and actual costs, and also adapt to surgeons and proceduralists changing plans on the fly. So if they happen to use like more supplies than it was planned for, then this can also be incorporated into the budget accounts, and so that you don't lose track of, or don't underestimate how much you are actually spending on like a single case. Another area where AI can be very helpful is in keeping inventory of supplies. An AI can optimize the standardization of supplies, which basically means calculating how much supplies should be kept in certain places, as I already explained. So since the Alberta healthcare system is already standardized, an AI can still be very helpful for us because it can keep track of supplies that are about to be expired. I already mentioned how they currently adapt to expiring supplies, which is just moving it to a unit which is in greater need of that supply before it's about to expire. However, an AI can also keep track of supplies that are about to be expired, which means reducing waste and also removing expired supplies in a timely manner so that they are not used in an OR and end up hurting a patient. Of course, this would take a load off of staff to keep track of like expiring supplies. And obviously, like when people are managing things like this, it's easy for certain supplies to like slip through the cracks or something, and we wouldn't want that to happen. So an AI would definitely be helpful there. It has also been found for a 342-bed mid-Atlantic hospital. Applying machine learning in this way to reduce expired supplies saved them an estimated $2.25 million annually. Lastly, AI can be used to automatically enter medical codes for billing and communication, thus decreasing administrative workload and improving accuracy. Since we discussed how auditing for such financial mistakes can actually cost more than the mistake itself, the best approach is definitely to prevent those mistakes as much as possible in the first place, which is what AI can do for us. So next we will be talking about billing management. And as we all logically know, a hospital consists of more than like the people inside of it. It's also like a gigantic building with many different pieces of infrastructure and moving parts. And it's a very complex system of which there's like nothing really like a hospital anywhere else. And this involves like maintenance, renovation, IT, and energy cost management. So basically how things currently are with building management. With regards to building maintenance, there is a department called the Facilities Maintenance and Engineering Department, which is responsible for overseeing the maintenance of the infrastructure of the building. They have basically a shift where they periodically check for things that need to be replaced or repaired, and it's managed much in the way that you would expect a building to be managed. If there's something that needs to be repaired, like heating or something, that they would come in and repair it. The thing is, they are employed under Alberta Healthcare Services, and they are not employed by the site, which means that the people who are working in the Rocky View Facility Maintenance and Engineering Department are not actually employed by Rocky View, but they are employed under the provincial healthcare services, so they can move around between like hospitals and take care of many different hospitals at once. And yes, there's periodic maintenance of hospital infrastructure, just like any other building, to make sure it there isn't any safety issues and everything is up to date. So with regards to renovations, Lori told me that there's constantly almost like 10 or 20 renovations going on in the building at the same time. Obviously, it's a very large building with specific needs, so having so many renovations going on at the same time is not exactly surprising. So usually renovations are outsourced to a private construction company, and in order to decide whether or not they want to do a renovation on this building, you would have to do a survey of the land and evaluate the need for a renovation, then apply for funding, which, as we already mentioned, is definitely a very strenuous process. And of course, it may not get approved. So, what can AI do to help in this situation? First of all, AI can give predictions ahead of when parts are expected to fail, thus allowing mechanics to replace them before they fail. And this is for predictive maintenance, for example, of building components such as like heating or water or gas, etc. Using this in tandem with existing maintenance schedules will definitely help to extend the lifetime of machinery and save money. In addition, AI can help with analysis for renovations in the hospital. As I currently mentioned, the staff of the hospital, such as the administration team and also the external private company who is responsible for doing the renovations, would survey the land and look at how necessary a renovation is and then decide whether or not to go through with it. In order to assist with this process, and the AI can analyze the need for renovations by calculating the need for space based on foot traffic, size of equipment, building codes, and such. So it can reduce the workload of staff and automatically take into account certain regulations that have to be abided by when you're talking about a building and its renovations. This will help administrators when they're evaluating whether it's necessary in order to save time and money. Lastly, AI can help with IT and cybersecurity. Currently, the security of the computer system in the hospital can definitely be improved. I don't want to expose the healthcare system too much here, but frankly, even the passwords on computers right now are so weak that it's kind of embarrassing. And of course, an AI could detect threats as they emerge and improve the security of patient information. After all, privacy and protection for patient information is one of the most important things in healthcare ethics. And so there's no reason why cybersecurity should be as lax as it is now. Of course, these computer systems are storing essential information on these patients and their healthcare records. So if there was to be a data breach, it would definitely be disastrous and like a huge invasion of patient privacy, which is one of the most paramount things in healthcare ever. So there you go. Next, we'll be talking about patient management. This includes patient transport, bed management, and wait times. Now, some of you might not know about what exactly goes into managing like a patient's like comings and goings. It's definitely a more complex process than you might think, and it involves a lot of moving parts. So here I will be explaining how exactly it works. So first of all, admitting. There are several streams for admitting patients, but they're all condensed into the same system at the end. The patient could come into the emergency room, and then you would have to figure out what's wrong with them, and then send them to whichever unit is best fitted to their condition. Or you can have direct admission to a unit. For example, maybe a patient did their homework ahead of time, or they were referred here. Then they would go directly to the unit that's most relevant to them. If they had like a broken arm, something, you would send them to orthopedics, for example. The last type of admission is admission for surgery. So if someone is has an appointment for a surgery, they would come in and stay into a bed. For example, if someone had like a day surgery, they would come into the day surgery department. They would get prepared for their surgery, do the surgery, and afterwards they would leave. Or if they need time for recovery, they would send the patient up to a bed, and they would stay for like a certain amount of time. There's also backup units for when the appropriate unit is full. So definitely right now, the hospital is operating at over full capacity. So sometimes there will be units that don't have enough beds for a patient. And for example, our example of a patient with a broken arm, if they don't have enough beds in the orthopedic unit for whatever reason, then they would send them to the next most appropriate unit, which is what the backup units are. So the patient would be assigned to a bed for their stay, and as they transfer out of the unit or discharged, this information is recorded in the ADT system, which is a very, very self-explanatory acronym for admission, discharge, and transfer system. So this keeps track of the location of each patient at a certain point in time. So within the hospital, you would know where each patient is and what they're supposed to be doing. Yes, patients often miss appointments, so they must be rebooked. In that case, there's a little bit of juggling around that has to be done by the staff at the ground level. Yeah, the ADT system also coordinates about 90 downstream systems, for example, food, portering, and housekeeping. For example, if you were a patient and you ordered a meal from the cafeteria would have to know like where you are and what unit you're in, and at what time you would be in that unit in order to deliver that food to you. And yes, the ADT system is also a digital system, so it's kept track of on a computer. Okay, now we will continue talking about how patient management is done right now, and we will be talking specifically about wait times. So the priority of cases is organized by least urgent to most urgent. Sometimes when doctors are largely swamped with work, which actually they are constantly swamped, you would have to prioritize the most severe cases over the less severe cases. And that definitely requires professional judgment. So the hospital, as I said before, is almost always running at 15 to 30% overcapacity. So patient beds have to sometimes be placed in hallways or lobbies. And this is definitely a problem, but it's something that's kind of a larger problem in and of itself regarding like healthcare funding and things like that. So wait times will definitely vary based on your unit. If you're looking for an ICU bed, you could wait up to 30 minutes, which is not that long compared to the potentially 7 days that you might have to wait for a specialized mental health care bed. And this is definitely a problem, as you can imagine, because if someone is in high distress and their mental health is in an emergency situation, you wouldn't want them to stay in a high stress location such as the emergency department for 7 days. It's obviously detrimental to the patient's health and can definitely be improved. So patient discharge time is estimated by the doctors and nurses based on their own experience. When a patient is admitted, there is a form that they have to fill out, and the doctors will estimate how long it might take for the patient to be discharged. Of course, this can vary based on the outcome of their procedure or what exactly happens during the length of their stay. So it's not an exact science, but currently it's just done by healthcare professionals based on their own expertise. And here on the side, I have a screenshot of the emergency department wait times on the Alberta Healthcare website. So on this website, you can actually see in real time, it's updated every 2 minutes, right? You can see the wait times for each like emergency hospital and judge for yourself based on that which hospital would be best for you to go to. Okay, now we will be moving on to what AI can do to help in order to give better patient management to hospitals. So all of these examples I have listed here are kind of related to improving wait times and ensuring that people get the care that they need as soon as possible. Firstly, you can predict patient discharge times based on various factors, such as the procedure they had done, if they had one, and their symptoms and their medical history. So it's kind of like what doctors and nurses do to predict discharge times right now, but instead of a human doing it, it's an AI who can, as we all know, take patterns into account and gradually improve their predictions over time. So this way you can give an empty bed to someone who is waiting and also clean beds as soon as someone is scheduled to leave. And this way you can improve wait times and prevent people from like waiting too long for a bed. You can also predict no-shows, which is unfortunately something that happens a lot. So people having an appointment but just not showing up. And this will improve efficiency and allow you to make contingency plans in advance if someone is determined to be someone who's likely to not show up like by the AI. Lastly, when doctors have too many cases and are short of time, which is constantly the case, as I said before, you can use AI to prioritize the severity of cases so that doctors can see the most severe cases first. So this would probably be based on their symptoms and like their diagnoses and things like that. Our next section is on staff. So the staff in the hospital, we will be talking about their unions, health and safety, human resources, and scheduling. So not only doctors and nurses, but there's a lot of administrative staff, porters, and housekeepers who keep the hospital running and work behind the scenes. Without them, the hospital would not be as well run as it is. So in this section, I will take care to highlight the important work that they do and how AI can be used to improve their working conditions and help their work be more efficient as well. So the current state of affairs with staff, we will be splitting into sections. Our first section is on health and safety. As we all know with the COVID pandemic, hand washing has especially become something that we focused on even more than usual. But in normal times as well, hospitals also have to take care to ensure compliance with hand washing. So there's always been auditing with hand washing. Essentially how this works is that an auditor sits outside a bathroom with a pen and a clipboard and records how many people go into the bathroom and actually wash their hands. So this is how you get those statistics on, for example, 95.9% of Rocky View Hospital staff are complying with hand washing standards. And this is how it's done basically. This is part of the workplace health and safety responsibilities that the hospital has to ensure for its employees. There's also a fit for work test. So as you know, you've probably been to certain public places where they've asked you the questions like, have you been outside of the country within the last 14 days? Do you have any of the symptoms of COVID, etc.? And this is a test that employees have to do in order to make sure that they're fit for work and they're not putting themselves in any danger by coming to work. There's also a system for reporting unsafe incidents. And if an employee feels unsafe in an environment, then there's a system where they can report it to the higher ups and have something be done about it. There's also a workplace health and safety committee in order to ensure that employees have like high standards for health and safety, and their safety is as close to guaranteed as it can get, basically. And the next section we'll be talking about is scheduling and payroll. So basically how this works is that there is tracking by an electronic system. If someone calls in for a sick day or something like that, this is entered into an electronic system so that it can be kept track of by the supervisors. And even though there's tracking with this system, it definitely doesn't make any decisions. All of the decisions for scheduling and payroll is done by a supervisor. So a supervisor would decide whether or not you are approved for leave if you apply for it, and they would be responsible for finding a replacement for a shift so that there's an appropriate number of staff constantly. As well, they manage the payroll and determine do calculations on how much you should get paid, etc. Our next section is on portering staff and housekeeping staff. So portering staff are the people who move patients around. As you can see in this picture here, they drive the patients around in these stretchers and move them from unit to unit within the hospital, and they help the patients get back home as well sometimes. They walk them to the front door, make sure that they have a ride home, and overall ensure that try to make sure that there's no falls or anything. And housekeeping staff is pretty self-explanatory. They are the janitorial staff who are responsible for cleaning beds, cleaning the building of the hospital, and cleaning the washrooms and rooms and stuff. So There is a teletracking system that's used to alert porters when patients need to be transported out of a unit. What this is that they carry around a device that tells them when they where they need to go at what time. And once they arrive to the unit, they pick up their patient and drive them to the destination. And then once they arrive, they report to the system that they have completed their task, and a new task is assigned to them subsequently. So this is how it works currently. There's also a digital notification system for housekeeping. So basically, when a patient is discharged and their bed needs to be cleaned, a nurse will notify the housekeeping staff by pressing a button, and then the system will alert one of the staff of housekeeping to go to the location of the bed and clean it before the next patient arrives. However, there is a problem with this system because housekeepers are often unable to keep up with it. So sometimes they can only clean the cords that are next to the bed, for example. So actually, one of my responsibilities as a volunteer at Rocky View is to just like clean in the beds, like which the housekeepers are unable to clean themselves. So the housekeepers would clean the cords and I would clean the beds and pillows before the next patient comes in. And so obviously there is a gap in the system since they need volunteers to supplement that gap. Yeah, from this you can see that there is a bit of a problem that can be solved. As well, you must also keep track of patient belongings when a patient is admitted to the hospital. Their belongings are turned over, and if they are transported from one unit to another, their belongings also have to be transported along with them so that so that they aren't lost. As well, there is okay. I'm trying to think of something. Okay, never mind. There was something that I wanted to say, but I forgot about it. I'll let you know if I think about it later. Anyways, next I'll talk about what AI can do to help with staff right now. AI can be used to build a shift schedule that takes into account many different factors. For example, you can take into account someone's preferred shift times, their vacation days, the ratio of staff to patients that you need to maintain in a hospital, and guidelines for working hours. So this way, AI can be used to maintain more consistent shift times for staff, which would be definitely beneficial towards the mental and physical health of workers. As you might know, there have been many studies on the effect of shift work on the mental health of shift workers. And it has been found that the sleep deprivation is a huge problem and it can cause mental and physical detriment to those who are working inconsistent hours and long hours. So in this way, an AI could be helpful because it would help you organize more consistent shifts for people. And since we've already mentioned health and safety, this also plays into it as well, because if you have more consistent working times, you will definitely see an increase in your physical and mental health. In addition, there has been a new AI being developed to use image recognition to see if workers are not using the correct PPE in places that they are supposed to be using it. For example, if you're not wearing a face mask, the image recognition could see that you're not wearing a face mask and alert you to that there's like a danger in not wearing a face mask. This technology could also be used to audit for confirmation to things like hand washing. As I talked about previously, like how hand washing is audited currently is an auditor just sits outside the bathroom and counts how many people go in and actually wash their hands. This is obviously kind of blatant. So there could be a better way of doing this that's more subtle and probably would give more accurate results as to how many people are actually complying with hand washing rules when they don't think that they're being watched. And this can be done with AI. If there's an image recognition like scanner or something, they can recognize if someone has washed their hands or not, or by like recognizing the sound of the tap running, for example. So yes, this can be used to audit for this information and make it more subtle than how it is handled right now. Lastly, AI can also be used to design more elegant systems for porters who are transporting patients. For example, it could take information about which porter is closest to the patient's location. It can take into account time for breaks for the employees and who has shifts that are almost over. Like if someone's shift is almost over, then they wouldn't want to give a job that takes a long time to them. This way, it would decrease the workload of these employees, and patients could also enjoy a faster transport system that's more efficient. So they wouldn't have to wait as long as they do right now. So now I have some flex questions that are more fun and like creative questions. These questions are things that are just asked Lori that didn't fit into any of the previous topic categories that we've talked about. I asked them simply out of my own curiosity or because I thought it might be relevant to someone who is interested in how AI could be employed in healthcare logistics. So the first question I asked her was about COVID-19. I asked, what are some unexpected obstacles that you had to deal with because of the COVID-19 pandemic? And she answered that there was a hand sanitizer shortage. Shockingly, right? The supplier that was standardized in the supply chain could not keep up with the demand for hand sanitizer, and the supplier began using industrial grade alcohol rather than pharmaceutical grade. And what this means is that the hand sanitizer smelled like disgusting old tequila, and it was absolutely horrible. You wouldn't really think that it's such a big deal to have bad smelling hand sanitizer, but uh, I feel like you have to experience the tequila hand sanitizer before you can judge because it's really terrible. And in the hospital, we are always very mindful to keep the environment scent free because patients can be sensitive to these scents and it could definitely create a disturbing environment, which we wouldn't want. Yes, from my own experience of using the tequila hand sanitizer, it's let me just say that it's very nasty and it was a prudent decision and a well-made decision to throw all of that out. So I thought this was interesting because I talked about previously that AI could have a use in supply chain standardization, but this example goes to show that even a substandardized supply chain will still face problems in unprecedented situations, like the COVID-19 pandemic. So therefore, when someone is making an AI whose purpose is to standardize the supply chain, I think it would be cool if it could actually take into account contingencies like this. For example, it could give sources of potential backup suppliers or predicting which supplies are most likely to be in shortages in situations like this. So the next question I asked her was, if you could automate any task you want in your job, which would it be? And her answer was an emergency contact fan out. So in an emergency, there's a procedure that has to be done. You have to contact like the doctor on call, the nurse on call, etc., and have them respond to the emergency appropriately. So an emergency contact fan out system would automatically alert staff when an emergency requires their presence. And Lori told me that it has already been implemented in other healthcare systems around the world, but it hasn't been used yet in the Alberta healthcare system. So she thinks that this would definitely be a useful thing to have. In an emergency situation, of course, even seconds could be life determining, right? Like this is definitely a situation where time is sensitive, and she told me that this technology would also, of course, decrease mistakes that you can make when contacting personnel, and it would also be very beneficial in that way as well. So I think an AI augmented system would also be very suitable for something like this because an AI could gradually learn who is most important to contact in situations like this. Of course, you wouldn't want like someone to be contacted if they aren't needed and then like cause an unnecessary disturbance. But an AI could learn like based on the nature of the emergency situation, different personnel and resources would need to be dispatched, and an AI would do so appropriately. So the next question I asked her was, what is part of your job that you think shouldn't be automated? And predictably, I think she answered parts of the job that require human interaction and building relationships. So she talks about her job involving lots of communication with unions, like worker unions, nurses unions, um, things like that. And these relationships take human interaction to build, and it's not suitable for an AI to take over that job. And she also surprisingly said scheduling vacation time is something that she doesn't think would be suitable for automation because she said that it's difficult for someone to predict like when they would need time off, and it's she doesn't think that it's something that an AI could do properly. Um, and she says that obviously there's a human aspect to all of these things. These employees are human as well, and because of the nature of life, I guess, they can't predict when they will need this vacation time and like how much they would need, etc. And this requires compassion for a supervisor to manage their employees and communicate with them well. So this is a situation where an AI might not be suitable. And yes, that is the end of my presentation. And if you have any questions, we have about like some time left, so you can ask me. And I hope this presentation has brought you some insight into the background work of healthcare logistics. And yeah, thank you very much for your attention. Oh, I see. There's some questions here. Shane has been answering them in the chat.
Yeah, I've been helping out a little bit behind
Okay.
the scenes.
I see.
No more questions?
Yeah, any more questions?
All right, well, thank you, Chun.
Yeah, okay.
I hope everyone learned some new things about healthcare.